Hey everyone, and welcome to the channel. Today, we're diving into a topic that affects millions of people worldwide, yet is often misunderstood: obsessive-compulsive disorder, or OCD. You've probably heard people say things like, "I'm so OCD about my desk being clean," but what does it really mean to live with this condition? It's much more than just a quirk or a preference for tidiness. It's a complex and often distressing mental health condition. So, let's clear up some myths and get into the real facts about what OCD is, what causes it, and most importantly, how it can be treated. Whether you're here for yourself, a loved one, or just to learn, I'm glad you're here. Stick around as we explore the journey of understanding and managing OCD together. First things first, let's break down the definition of OCD. At its core, OCD is characterized by a cycle of obsessions and compulsions. Obsessions are unwanted, intrusive, and persistent thoughts, images, or urges that cause significant anxiety and distress. These aren't just everyday worries, they're intense and feel out of your control. For example, someone might have an obsessive fear of contamination from germs, a persistent worry that they've left the stove on, or intrusive thoughts that go against their personal values. These thoughts aren't a reflection of a person's character. They're symptoms of the disorder. Now, to cope with the anxiety caused by these obsessions, a person with OCD feels driven to perform compulsions. Compulsions are repetitive behaviors or mental acts. The person feels they must perform these actions, often according to strict rules they've created for themselves. Common compulsions include excessive hand-washing, repeatedly checking locks or appliances, ordering and arranging things in a very specific way, or silently repeating a phrase to neutralize a bad thought. Performing these compulsions brings temporary relief from the anxiety, but it's a short-lived fix. The obsessive thoughts soon return, and the cycle starts all over again. This cycle can become so severe that it consumes hours of a person's day and significantly interferes with their life, work, and relationships. It's not about enjoying being organized, it's a relentless, exhausting battle inside your own mind. So, what causes OCD? This is a question researchers have been working on for decades, and the answer is complex. It's not just one single thing, but rather a combination of factors. First, let's talk about genetics. Studies have shown that OCD tends to run in families. If you have a first-degree relative like a parent, sibling, or child with OCD, you have a higher risk of developing it yourself. This suggests that certain genes might make a person more vulnerable to the disorder. Scientists are still working to pinpoint the specific genes involved, but the genetic link is quite strong. Next up are neurological factors, which have to do with the brain itself. Brain imaging studies have revealed some key differences in the brains of people with OCD compared to those without. Specifically, certain parts of the brain appear to be hyperactive. Think of it like a communication circuit that's stuck on a loop. This circuit involves areas like the orbitofrontal cortex, the anterior cingulate cortex, and the striatum. These parts of the brain are involved in decision-making, error detection, and emotional regulation. In OCD, this circuit gets overactive, leading the brain to constantly send out false alarms, telling the person that something is wrong and needs to be fixed. This is what fuels the obsessive thoughts and compulsive urges. Another key player in the brain is a neurotransmitter called serotonin. Serotonin is a chemical messenger that helps regulate mood, anxiety, and impulses. It's often called the feel-good chemical. Many researchers believe that a problem in the serotonin system contributes to OCD symptoms. This theory is supported by the fact that medications that increase the levels of serotonin in the brain are often very effective in reducing OCD symptoms. It seems that when serotonin isn't working properly, the brain's communication circuits can go haywire. Finally, we have environmental factors. While genetics and brain biology might set the stage for OCD, life experiences and environment can act as triggers. Stressful or traumatic life events, such as the loss of a loved one, major life changes, or experiencing abuse, can sometimes precede the onset of OCD or make existing symptoms worse. For some people, even infections, like streptococcal infections in childhood, have been linked to the sudden onset of OCD symptoms in a condition known as PANDASTAT-S, pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. So, It's really this intricate dance between our biology and our environment that can lead to the development of OCD. No single factor is the whole story. Now, we get to the most important question: can OCD be cured? This is a question filled with hope and anxiety for anyone affected by the condition. And here's the honest, empowering answer. While there is no cure, in the sense that OCD can be completely and permanently eliminated forever, it is highly treatable and manageable. With the right treatment, people with OCD can significantly reduce their symptoms, regain control over their lives, and live full, happy, and productive lives. Think of it less like curing a cold and more like managing a chronic condition, like diabetes or asthma. Learn the tools and strategies to keep your symptoms in check so they no longer rule your life. The goal of treatment is to get rid of every single intrusive thought. Everyone has those, but to change your relationship with them so they no longer cause distress or trigger compulsions. So, the message here is one of profound hope. Recovery is absolutely possible. So, what does this highly effective treatment look like? Let's talk about the gold standard approaches. The most effective treatment for OCD is a type of psychotherapy called exposure and response prevention, or ERP. It sounds a bit intense, but it's incredibly powerful. ERP works by gradually and systematically exposing you to the thoughts, images, objects, and situations that trigger your obsessions and anxiety. That's the exposure part. Then, the crucial second part is response prevention, where you make a conscious choice not to engage in the compulsive behavior you would normally perform. For example, if you have a fear of contamination, you might be guided by your therapist to touch a doorknob and then resist the urge to wash your hands free. By doing this repeatedly, you learn a vital lesson. Your anxiety will naturally decrease on its own, even if you don't perform the compulsion. You learn that the catastrophic outcomes you fear won't actually happen. It's like building a muscle. The more you practice confronting your fears without giving in to the compulsions, the less power the obsessions have over you. Your brain essentially learns that the initial alarm was false. ERP can be challenging, but it is life-changing for so many people. It's about taking your power back from OCD. Alongside psychotherapy, medication can be a very helpful tool, especially for those with moderate to severe OCD. The most commonly prescribed medications are a class of antidepressants called selective serotonin reuptake inhibitors, or SSRIs, as we discussed earlier. These drugs work by increasing the levels of serotonin in the brain, which helps to better regulate mood and anxiety, and can reduce the intensity of the obsessions and compulsions. It can take several weeks, sometimes up to 12 weeks, to see the full benefits of an SSRI, and it often requires higher doses for OCD than for depression. For many people, the most effective approach is a combination of ERP therapy and medication. The medication can help lower the anxiety enough to make it easier to engage in and benefit from the challenging work of ERP. Finally, let's not forget the power of self-care and lifestyle adjustments. While these aren't a replacement for professional treatment, they can be a fantastic support system. Things like regular exercise, getting enough sleep, and practicing mindfulness and meditation can all help manage stress and anxiety, which can in turn reduce the severity of OCD symptoms. Mindfulness, in particular, teaches you to observe your thoughts and feelings without judgment and without getting caught up in them. It helps you create a little bit of space between you and your obsessive thoughts, allowing you to see them for what they are, just thoughts, not facts or commands. Building a strong support network of friends, family, or support groups who understand what you're going through is also incredibly valuable. You don't have to face this alone. So, to wrap things up, OCD is a real and challenging brain-based disorder, not a personality trait. It's a cycle of distressing obsessions and compulsive behaviors driven by a mix of genetics, brain function, and environmental factors. But the most important takeaway from all of this is that there is incredible hope. OCD is highly treatable. Through evidence-based treatments like ERP and medication, you can learn to manage your symptoms and reclaim your life. If anything we've talked about today resonates with you, or if you're worried about a loved one, please reach out and seek help. Talk to a doctor or a mental health professional who specializes in OCD. Taking that first step is the bravest and most important thing you can do. You deserve to feel better, and recovery is within your reach. Thank you so much for watching and for taking the time to learn about this important topic. If you found this video helpful, please give it a thumbs up and consider subscribing for more content on mental health and well-being. Share it with someone who might need to hear this message. Remember, you are not alone. Thanks again, and take care.